we understand that there will be areas where, or people who can self-isolate that have 10, 15, 20 people. For those are the isolation units that we are trying to identify through NEMO, and I think we already have a list, or we were promised we were going to have a list that would be activated by the end of today. And again, that's where you bring all your other stakeholders, because it could be that most of these people don't really need a healthcare person alongside them. So you need the other NEMO stakeholders to come on board and help us in that isolation process to make sure it really happens.
Will there be in that handbook 3B for the self-isolation? Because if I'm going to self-isolate myself from work, I can't just phone the boss and say I'm self-isolating. You still need a note from a doctor, so you still have to come in contact
Yes,
with
and
the formal system.
yeah, I don't have the number of persons since January that we have been doing that. Remember, students who came back from China, they were in self-isolation for 14 days, and you would have a healthcare worker go and look for them. But it's a vast amount of people that we were following.